My name is Sydney. I'm going to be your nurse today. It looks like we have doctor's orders for a head-to-toe assessment. Could you give me your name and date of birth, please?
Sylvia Buttress, 10/31/1983.
Okay, and do you know where you are?
Yes, I'm at the doctor's office.
Alrighty, and who's the current president?
Donald Trump.
Okay. So your alert and oriented time's 4. It looks like you're clean and dressed appropriately for the visit. Could you tell me your height and weight?
5'2", 130.
Okay. So your skin appears to be cool and pink and dry. There's no bruising of different stages, which would be an indication of abuse. There doesn't appear to be any lesions or any concerning moles or spots. Okay, can you tell me what your pain is on a scale of 0 to 10?
0.
Okay, so we went ahead and took your vital signs. Your blood pressure was 120/80. Your oxygen was 98. Your respiration rate was 16, and your temperature was 98.6. Alrighty, so we're going to check your pupils. Okay, so it looks like your pupils are equal, round, reactive to light, and accommodations. I'm going to go ahead and check your ears. Okay, there doesn't appear to be any drainage or earwax buildup. Okay, if you could tilt your head back so I can check out your nose. Okay, so nares are patent. I'm going to go ahead and inspect your mouth. If you could just stick out your tongue and say ah.
Ah.
Alright, so mouth is pink and moist. I'm going to go ahead and check your lymph nodes. Okay, is there any tenderness?
No.
I'm going to go ahead and listen to your lungs. You could just take a deep breath for me. Okay, now I'm going to check your back. Alrighty, so there doesn't appear to be any popping or wheezing, which would indicate crackles or rails. Your breathing is easy, regular, and effortless. Okay, so I'm going to go ahead and check out your back. If you could just stand up and lean over for me. And then
I palpate down my.
Okay, so I'm not seeing any signs of scoliosis, kyphosis, or lordosis. That would be any abnormal curvature, so like an S-curve or a hunchback, or what's common in pregnant women or toddlers, where your spine would be curving in towards your abdomen. So there doesn't appear to be any jaundice or redness on your skin. So that would be any yellowing if there were jaundice present. So now I'm going to listen to your heart sounds. So now I'm going to listen at your PMI, which would be your point of maximal impulse. And then I would listen to your apical pulse for 1 full minute. Okay, so I'm going to check for any signs of dehydration. If there were signs of dehydration, there would be tinting, which means when I would pull your skin up, it would stay that way. Okay, so if you could just raise your hands up and push them up against my hands. Okay, now push them down. We're going to do the same with your arms. Okay, we'll do your feet. Okay, and was there any pain?
No.
Okay, so that means that there's no Homan signs, which would show blood clotting in your calves. Okay, now we're going to do your thighs as well. Okay, so if you could give me your hand, I'm going to check your capillary refill. This just shows that there's good blood flow to your fingers. Okay, so then we'll check your toes as well. Capillary refill is good. It's within 1 to 2 seconds. Okay, so now we're going to check your pulses. I'm going to do your temporal, and then your aortic. So now we're going to do your brachial and your radial. Then I would check your femoral pulses and then your popliteal. Okay, then we would check your pedal pulses. Okay, and then your tibial. All pulses are strong and equal bilaterally. Okay, so if you could lay down, I'm going to look at your abdomen. Okay, so your abdomen looks flat. There's no protruding or distension, so that doesn't. So there's no signs of any enlargement. And can you tell me when your last bowel movement was?
Yesterday.
Okay, and your menstrual cycle?
About 2 weeks ago.
Okay, so now I'm going to listen to your bowel sounds. Okay. Okay, bowel sounds are present in all 4 quadrants. So I'm going to palpate. Let me know if there's any tenderness.
No tenderness.
Okay, so now I'm going to check for any swelling in your feet or ankles. Okay, so there is no swelling. If there were signs of edema and there were pitting, it would mean when I push in on your skin, it would stay that way. Okay, so we're done with your head-to-toe assessment. I'm going to put up 3 bed rails. Is your head comfortable like this?
Yes.
Okay, here is your call light. I'm going to put the bed at the lowest setting. Is there anything else that I can get for you before I leave?
No.
Okay, so I'm going to scrub out and then I'm going to go document.